Hello, and welcome to Prairie Pulse. Joining us today is Governor Doug Burgum, of course, the governor of the great state of North Dakota. Governor Burgum, thanks for joining us today.
John, great to be with you. And I just want to say at the front end, thank you for all that you and Dave Thompson and your entire team at Prairie Public has done during this entire pandemic to help keep the citizens of North Dakota informed. Really appreciate it. Really highlights the important role that Prairie Public TV plays in North Dakota.
Well, thank you, Governor, for those kind words. But we're here today to talk about what everybody's talking about. And I know you've been doing this for a long time in the last few weeks. But let's talk about what's going on currently. You're allowing businesses to begin reopening. Can you talk some about what led you and your administration to finally undergo these, I guess we'll call them soft reopenings?
Well, I can. The first place to start, of course, is that, as people know, we're one of the states that closed down less of our economy than almost any other state. 93% of the jobs in North Dakota, which includes all of energy, all of agriculture, all of manufacturing, all of construction, all of government at all levels, and all of K-12 education, which of course is a huge employer, and a higher ed. Well, we shifted to distance learning both in K-12 and higher ed. Everybody kept working and kept doing their core missions. And so the 7% of employment that was affected were the ones that we called high contact businesses. That would have been bars, restaurants, movie theaters, gyms, and then personal care businesses, whether hair care, salons, massage therapy. And again, the high contact businesses were not that they weren't essential. Of course, we know they're essential. So we used the word high contact because it was where you could have people close to each other for more than 10 minutes, close meaning less than 6 feet for more than 10 minutes. So this is the way to shut down the least amount of the economy, but have the most effect on slowing the amount of moments where you could actually be having the virus transmit from one human to another. And I think worked out as a very positive strategy, and part of the phase one of opening again tomorrow. It relates to personal care and bars and restaurants and movie theaters. And they're all opening up under what we call the North Dakota Smart Guidelines. And these are guidelines that have a lot of common sense built into them about how to protect your team members, how to protect your customers, and how to protect the employee business itself to make sure that everybody's safe as those businesses come back online.
Well, Governor, yeah, with all that said, with the people you're letting reopen, what's sort of been the reaction to all that? Because I know you've had protests that we were closed down, and now some people are saying, should we be reopening? So what kind of reaction are you getting?
Well, I think that we're feeling like we've been driving down a road in uncharted territory. There's not even a road. It's like not even a two-track, because a two-track would imply that somebody's driven there before. So we're driving basically into unknown territory. And we've managed to steer this path where in North Dakota, we've had a light touch of government and a high reliance on individual responsibility, which we know North Dakotans are great at. I think it's been a fantastic combination. It's important to know that as far as tomorrow, it's all voluntary. For example, faith-based organizations, churches were never had to close down, but out of, I think, respect and safety for their congregations, even during Holy Week, a lot of those faith-based organizations closed and shifted to new methods of changing their approach, whether online, televised video, other connection that they're doing. And so we've just seen a tremendous amount of innovation. And again, I compliment every nonprofit, every faith-based, every business in North Dakota that's had to figure out a way in this uncharted territory to figure out a new way to serve their customers, serve their congregation, serve their patients. We've seen a lot of innovation, and I think it just speaks to the resilience and the ingenuity that we know resides in everybody in North Dakota.
Of course, as I mentioned, there are people that disagree with your decisions and to reopen, and I'm sure you can understand their concerns and maybe even their fear. But so what's your message to those folks?
Well, I think the path that we went on across the nation in terms of even the states that issued a stay-at-home or a shelter-in-place order, they were doing that to preserve hospital capacity, because when you have something that there's no cure for and it's highly contagious, the way you save lives is to make sure that you've got the capacity to serve people at the highest level of care. And if someone is really, really sick with it, that means they have to be in an intensive care unit. They have to have a ventilator. At no point during any of this entire process have we consumed more than a couple of percent, 1 or 2% of the state's existing available ICU capacity. And we'd also built up surge capacity to handle thousands of more, almost doubling or more the capacity for hospital capacity in our state. So we were ready for a surge. It never happened. We preserved all this capacity. And when we preserve the capacity, we also preserve the personal protective equipment, the PPE that we need to protect our healthcare workers. And so by moving into this North Dakota Smart Restart, we feel confident that we've built some capabilities we didn't have a month ago around testing, around contact tracing, around targeted and isolated quarantining, and around preserving and building up our healthcare capacity that we're ready to handle the future that's ahead of us now, because we've got a lot of tools and capabilities we didn't have even 5 weeks ago.
Sure. You talk about our healthcare workers. You mentioned them right there. What about our North Dakota hospital staff, nurses? How have they been during this crisis?
Well, we all knew we had great healthcare in North Dakota, and whether that was in long-term care, in our clinics, in our behavioral health, or in our hospitals across the state. And I think what we've seen here is we know that people that work on the front line, that get up and go to work every day in an uncertain environment, when they're working with a highly contagious disease, or you're working in an emergency room, you don't know if the next person that walks in may be contagious. I just have to say they've responded as they always do, heroically. It's perhaps why they went into the field in the first place, but enormous gratitude. And then the ones that have stepped in alongside of them, our North Dakota National Guard that are working on our testing outreach. I mean, part of the reason we're confident about being able to start to reopen is we're now have moved up to the number 4 spot in the country in terms of testing per capita out of all states in the District of Columbia. And yet we're testing more than 46 other states per capita, and then we've got the 5th lowest in terms of positives. So in terms of being well prepared, well positioned, with great data, great information, we're about as good a spot as you could be as any state in the country.
Well, you're kind of talking about this. Can you talk statistically how we compare with the other states? As probably per capita is the way we should work that. And because I know you stay in contact with governors across the United States.
Well, I think again, we're really excited to see our testing capability grow so rapidly. We've got a plan in place that by May 9th, we'll have tested every person that works in healthcare and every resident in a long-term care facility. We're doing thousands of people on outbound testing. We're touching all of our tribal communities. We had a great day yesterday on Thursday, or that would be today, but it's being shown tomorrow, but a great day on the testing up at Turtle Mountain, which is the 3rd tribal outbound testing we've done, again, trying to focus on vulnerable populations. So we know that we're I don't want to say the envy of other states in terms of how we're moved up to the number 4 spot on testing per capita. We also, there was NPR actually came up with a national story the other day that said North Dakota was number 1 in the nation in terms of building out our contact tracing capability relative to our population in our state. And that, again, allows us to open with confidence, because if we find a positive, we talk to them within 4 hours, we find out who they might have been in contact with, and then in a very effective and targeted way, we can ask people to stay home and self-isolate as opposed to be spreading. And that allows us to open up the economy with confidence, but still protect all those that are most vulnerable.
Sure. Well, a little bit about, of course, if you turn on the TV, you hear it in social media. There was a lot of pushback from national media, from doctors, from medical experts against states like North Dakota, Iowa, South Dakota, who never issued a shelter-in-place order. Can you comment on that?
Yes, I would say, we try to listen to a lot of information. We took a look at what was happening around the world, both in Asia and in Europe. We saw what was happening on the East Coast. We listened to the experts, and I don't want to add the adjective so-called experts, but they accompanied with them some really striking forecasts that we took a hard look at those and said, we really don't believe in those numbers. We think that North Dakotans using their self-responsibility. It really isn't about what government says in terms of issuing orders. It's about what people do, and all the data, whether it's tracking cell phone data, whether it's traffic data. We know that movement was down. We know that physical proximity to other people was down, and we think that the compliance in North Dakota without some of those orders that people called for, because the goal wasn't who can issue the most orders, the goal was how can you have the most people acting responsibly to slow the spread. And I think, again, I'd like to think North Dakota came out #1 on that. Least amount of government involvement, highest amount of compliance. It's North Dakota success formula.
Yeah. Speaking of compliance, Governor, with this reopening, how will the local or state police monitor compliance? And so what will happen? Will there be, is it sort of you're depending on the business and individuals, or will the police be monitoring?
Well, I think when it comes to compliance, the first thing that a business owner has in mind, and of course, having been involved with small businesses and large businesses my whole life, I mean, the #1 thing today, in this environment, 5-6 weeks ago, we had the lowest unemployment in the nation. If you had a set of great team members that were working for your employees, you wanted to make sure you protected them, whatever the circumstance was. In this case, you want to keep your employees safe in this health environment. #2 is you want to make sure that you're taking care of your customers. And so I think that the compliance around reopening is going to be businesses making sure they're creating an environment that people feel comfortable coming back into. So I think a lot of the compliance is going to be market driven, because if people go to a bar or restaurant, it's too crowded, they may not feel comfortable, they may want to go someplace else. So I think that again, the service oriented, customer focus, business orientation that North Dakota's small business owners, that's going to drive most of it. If we do find, say that there's some extreme non-compliance, and we've got large groups of people in small combined places, and that's happening regularly, and people are not complying, and people are concerned about that, then at that point, the state health officer has the ability to issue orders, and then in the local health officials that would be involved in that. That's where the compliance, and again, this is would be considered a infraction, punishable up to $1,000. But I don't see that really happening in North Dakota, because I think there's going to be a powerful incentive for people to create spaces that invite customers back in.
Mm-hmm. Well, Governor, with your crystal ball, and because the question is going to be, with the reopening and everything going on, wouldn't you expect a rise in cases over the next week or two?
Well, I think that some of the rise in that we've seen in absolute cases goes along with the amount of testing we're doing. I mean, today we had another day of over 1,900 tests. When we started this, on some days we were doing 100 or 200 tests, so we're doing 9 times as much, almost 10 times as much testing as we did before. And yet today we only had 1.8% of those tests that came back as positive, and which is one of our lowest rates on the whole thing. So when we're doing more testing and having a lower percentage of positives show up, we feel we're in a good position. As we have more interaction, we have the possibility for more spread, but that's where, if we find a set of positives, we come in with contact tracing, and we do the very targeted quarantining and isolation, as opposed to asking the whole state to stay home. We're really asking only those people that we know are positive or had contact with positive. So we think that we can have a increase in rise in cases, even a substantial increase in rise of absolute cases, but a smaller percentage of the population with actually less spread, because of the skill sets that we have and the capability around testing, contact tracing, and targeted quarantine.
Well, let's go back to reopenings for just a moment. With what you're doing on May the 1st, when do you anticipate sort of the next phase of reopenings, and what will happen then?
Well, I think we have to see how phase 1 goes. And as we've been through this whole thing, we're really using testing data as our compass, as our steering wheel, and as our accelerator. And if we keep having great results, then we can open more things up with confidence. If we start to see a spike pop up in a certain geography in a community, or if the spike happens related to a bar, a restaurant, a church, or a manufacturing plant, we want to address that in a targeted way, versus a broad way we had to over a month ago, when we didn't really fully understand everything we were dealing with, and then we also didn't have the capabilities because we didn't have the testing or the contact tracing capabilities that we do today. So I would say, again, it's a 14-day cycle for incubation. So we won't know whether the opening up is working really. So I've tried to coach people to say that we should think about this in 2-week steps. That 2 weeks from now, we'll have an indication of how well the changes we made tomorrow are working.
Okay, thank you with that. What about school children? When do you anticipate children will be back in school?
Well, again, I don't want to pick a date on that. I've said if you're trying to, when we shut the things down in terms of trying to shut the virus down, it was like turning off a light switch. When we turn it back up again, we want to turn a dimmer switch back up with the new North Dakota Smart Restart guidelines, which again allow people to reopen, but we're going to limit the amount of contact. Take 110,000 North Dakota school kids and throw them back into 175 school districts and probably 250 or 280 buildings across the state. You do that, and that's not like a dimmer switch. That's like flipping on the stadium lights at midnight. It'd be a bit of a shock to the system, and we know that in that population we have teachers that may fall into the vulnerable category. We've got students that may be immunocompromised. Like with bars and restaurants, we can ask them to have spacing where maybe they are limited to 50% of the customers they might have on their license for occupancy. We can't ask only half the school kids to come back. So there's a lot of complexity and nuance related to school openings. We've been working around the clock on that. Got another meeting actually later tonight on that topic. We hope to provide some guidance very soon on that about the direction that we're going, but we're not just thinking about this spring because for some people, there's only about 3 weeks left of school left. We're also thinking about summer school. We're thinking about summer programs. We're thinking about fall reopenings, and we're also thinking about entirely new things. One idea called an acceleration academy, which could occur the last 2 weeks of August, which would allow us to take those kids that may have not responded as well to the distance learning that's going on and work on getting them up to speed in the fall. But I do want to say thank you to all the teachers in North Dakota, all the parents who've got school kids, all of the administrators, all the school boards. What North Dakota's accomplished during this has been really remarkable. Many other states shut down their schools and no teaching is happening whatsoever. Within a couple of weeks, we had our school districts back up and running and doing distance learning in all 175 districts. And that's really a remarkable success story for the students of North Dakota. And it wouldn't have happened without amazing work by teachers, administrators, school boards, and Superintendent Baszler and the Department of Public Instruction here at the state.
Well, with that said, of course, colleges are now announcing that it looks like they'll be back with classes, at least in many states. I know Purdue, Arizona, now North Dakota colleges are saying they'll have classes in the fall, but do you think they'll be quite a bit different?
I think that higher education, like a lot of institutions, but higher education in particular, is going to look very different after this pandemic. The acceleration that happened so rapidly, where virtually every university in the nation had to become an online university, has changed the debate. It'll be a sea change in terms of the direction. I think people will understand that the role of technology in delivering education has gone up, and maybe the bricks and mortar have gone down. And I don't want to use oversimplified, but this is a little bit of Barnes and Noble versus Amazon in terms of selling books. And I don't think we're going to go back. I don't think we'll see things exactly the way we did. There'll absolutely positively be a role for on campus. I applaud and support the North Dakota universities that are indicating they're going to be open next fall for enrollment. We invite those students back, but I think you're going to see, even for students that are on campus, learning may look different in the fall with everything that people have learned, all the new innovations, all the new approaches, and again, in new forms of competition, because higher education, more so than K-12, there is a lot of competition. That competition is going to grow. The schools that are going to thrive are the ones that are able to innovate and respond and adapt to this new environment that we're going to be in. You mentioned Arizona State and Purdue. Those happen to be two of the schools, two land-grant universities in the country, which have been among the most innovative in the country. Those are two models that we in North Dakota should really take a look at and follow their lead, because they're doing some great things.
Yeah. With that said, there are some counties that have, are there still any counties with no cases, or at least counties where there are very few Why do you think that is?
Well, we've got 18 counties out of 53 that don't have a active case. And I think some of that is all mostly geography related. And if you take a look at those would be counties that are in the north and central part of our state where there probably is less inbound or outbound travel. And so it is, we had some hot spots early on in the oil patches. We've had, of course, there's a lot of movement in other counties that may have where we share geography with tribes, where those tribes are moving back and forth between metro areas. We've got other areas where there's tourism, where people are coming in and out. And then we've got, places where we had universities, where there's, again, a lot of people coming in and out, like in Grand Forks and Cass County. So I think it has to do with travel. In some of these counties, there's talked about the whole state that we've been practicing social distancing since 1889, that we're very good at that as a state. But some of the counties that have got really low population and large geographies haven't turned up cases. But that doesn't mean that the virus isn't there. When we went out and we're doing some testing early on in southwestern North Dakota, like in Slope County, we discovered people, when we did broad testing there at the Amadon Fairgrounds, that people that had no symptoms that still tested positive. So we've said all along, even if there's no positive test reported in your county, everybody should act as if the virus is there, because if it's not there now, with a flip of the calendar to May, doesn't mean it can't show up tomorrow. All it takes is one person who might be carrying it, and they may not even have any symptoms when they bring it to your community. So we have to, the whole state has to be practicing the North Dakota SMART guidelines.
Yeah. With that said, and with all the businesses being hit pretty hard with closures for this many weeks, and how long do you think it will take the state's economy to recover?
Well, I think John, as we've been going through this, we are really been battling three fronts. One is the virus, and we're making great progress on that. The second is the economic, not slow down, not turn down. It has been economic free fall. And some of that free fall has happened because we're a state where agriculture and energy we're key players in a global market. We cannot control global forces that are beyond our control. And we've had a huge demand drop in the case of oil. Normally the consumption is over 100 million barrels of oil today. It's off by over 30%. We're back. Gasoline consumption right now in the U.S. has not been this low since the 1960s. And so this is completely unforeseen by any economist. And it's going to take us a long time to recover on the oil front, because we'll need to have it's not about North Dakota businesses reopening and all of us driving more. It's about, how do we get all the airlines flying in the world again? How do we get people confident about travel? How do we get the economies going? How do we get trade reestablished? To do that on the ag front, different set of circumstances. Take all of our ranchers that've got cow calf operations. They sell into a very consolidated market that does, the protein processing, or as you would say, meat packing plants. Some of those have been hit very hard. Some of those have gone under closures. And so we're seeing, again, the supply chains disrupted in agriculture that are depressing prices. The low oil prices are affecting ethanol, which is a very important value-added part of our economy. And so again, we are, really challenged. Even in healthcare, as we prepared for the worst, there was a big demand drop for services in healthcare. And other than having hospitals that were overloaded, we had hospitals that were furloughing nurses because they had less business. So it's been a widespread across the board. That's going to affect, virtually every business in the state, but certainly our two biggest ones, ag and energy, are facing some tough headwinds. It's going to take us a while to get through this.
Governor, have you ever faced anything like this in your professional career?
Well, I mean, I'd have to say no, because I've not ever had to do crisis management during a pandemic. But when I take a look at things that are relevant in terms of managing through, I think getting through the dot-com crash in 2001 was somewhat similar, because it wasn't for the entire economy, but for those of us who were in tech, people saw a demand drop in some cases of 80, 90%, not 30%. So it was, how do you reinvent your business model when you've had a complete collapse in pricing and demand? And so at least I've got something that I can call on in terms of how you think through solving a problem, putting teams in place, creating clear vision, working and partnering with everybody, with legislature, other teams, local city community leaders, healthcare providers, bankers, business leaders. I mean, in North Dakota, it's performing so well. And the credit goes to all of the great leaders at all those levels across all the parts of the whole state. It's been fantastic. So great to work with everybody, prouder than North Dakota than ever.
Well, we are just about out of time, so real quick, what's your advice for people in the next couple of weeks?
I would say stay tuned. ndresponse.gov is where we have all of our guidelines for the North Dakota Smart Restart. We're asking people that are over 65, have underlying health conditions. There is still risk. You should do only what you're comfortable doing. And if that means staying at home, staying within your close family group, and not venturing into large crowds or until you've got real confidence that things are under control, we support that. We invite that because we're working every day to protect those people that might be the most vulnerable.
All right. Governor, we are out of time. Thanks so much. Well, that's all we have on Prairie Pulse this week. Please stay safe, and as always, thanks for watching.
Funded by the members of Prairie Public.